Hi, I am Dr. Arsalan and today we are going to solve the MCQs on chemical coordination or endocrinology. The first question is, these are all the functions of calcitonin except options are reduce blood calcium, increase calcium absorption, promote calcium excretion or bone development. As you know that the calcitonin is the hormone secreted from thyroid gland. The calcitonin is secreted when the blood calcium rises from its normal level, and the main function of the calcitonin hormone is to reduce the blood calcium level. It is done through three methods. Primarily, calcitonin hormone absorbs excess of the blood calcium and deposits it into the bones, helps in bone development. The second method is to stop reabsorption of the calcium from the intestines, and third method is to excrete the extra calcium from the blood through kidneys. This is called renal excretion of the calcium. So these three methods are mentioned here. If we look into these options, they reduce blood calcium. So this is the primary function of calcitonin. Second is increased calcium absorption. So this is not the function of calcitonin because calcitonin discourages the absorption of the calcium from the intestines. So option B is correct, that increased calcium absorption is not the function of calcitonin hormone. The option is promote calcium excretion. So it enhances the calcium excretion from the kidneys called renal excretion. As well as the bone development is caused by the calcitonin by deposition of the calcium into the bones. So the option B is correct, that the increased calcium absorption is not the function of calcitonin hormone. Next question is, the hypernatremia may induce dash. Given options are hyponatremia, hyperkalemia, hypokalemia or hypocalcemia. As you know that the hypernatremia, it means increased sodium level. Hyper means increased and natremia, it means the natrium or sodium. So if the sodium level in the blood increases, consequently the potassium level of the blood decreases. So it always causes hypokalemia or decreased potassium level. Hypo means decreased and kalemia, it refers to the potassium. Hypocalcemia, decreased calcium level in the blood. Hyperkalemia, increased potassium level in the blood, while hyponatremia, it is the decreased level of the sodium. Hypernatremia, it is made up of three words. The hyper means increased, natrium means sodium, and emia, it refers to the blood, within the blood. So increased sodium level in the blood causes decreased potassium level in the blood to maintain the homeostasis by negative feedback mechanism. Next is a surprising question, that in females, libido is caused due to secretion of dash. Given options are estrogen, progesterone, oxytocin or testosterone. Libido means sexual urge. As you know that the sexual urge is induced in males by testosterone hormone secreted from the testicles, while in females too, this same hormone testosterone is responsible for inducing the sexual urge or libido. So it's a surprising question that how testosterone is produced in females. It is produced in the adrenal glands. So we can say in females the sexual urge is maintained by the adrenal testosterone. Next question is, glucose intake into the cells is promoted by. Given options are insulin, glucagon, phosphocreatine or parathermone. So we should know that the insulin is the hormone responsible for the conversion of excess glucose from the blood into the glycogen, which is stored in the liver as well as in the muscles. Moreover, the insulin hormone also plays an important role in the uptake of the glucose by the cells, because insulin binds to this glucose and it transports this glucose into the cells. Therefore, in case of diabetes, when there is insufficient or abnormal insulin, the cells are deprived of the glucose intake. There is no insulin to push this glucose into the cells. Therefore, the cells are deprived of the glucose and the person feels fatigue, loss of energy, weakness and sense of hunger because the cells are hungry and are deficient in glucose. Therefore, this is a cardinal sign of diabetes, that the person experiences polyphagia or increased eating or increased hunger. So in this case, the option A is correct, that insulin is the hormone which promotes glucose uptake in the cells, while the glucagon hormone is responsible for the glycogenolysis. Glycogenolysis means the breakdown of the glycogen present in the liver and muscles. The phosphocreatine is a source of energy or high energy bonds, while parathermone, this is responsible for increased blood calcium. This is responsible to increase or maintain the blood calcium level. Next question is, dash is inhibited by insulin. Given options are glycogenesis, gluconeogenesis, lipogenesis or all of these. Glycogenesis means conversion of glucose into the glycogen. So it is promoted by the insulin. The gluconeogenesis, it is the formation of new glucose. Gluco means glucose, neo means new and genesis means formation. So insulin never forms new glucose or never promotes the formation of new glucose. So this is the correct option, that gluconeogenesis is always inhibited by the insulin. The lipogenesis means synthesis of lipids, and the last option is all of these. So the correct option is second one, the gluconeogenesis, because neither the glycogenesis or lipogenesis is promoted by the insulin. Next question is, all are the corticosteroids except, given options are aldosterone, estrogen, testosterone or oxytocin. As you know that the corticosteroids belong to the family of steroids, and steroids are lipids. And out of these steroids, the cholesterol is predominant steroid and is the precursor of the sex hormones, aldosterone as well as vitamin D. So the sex hormones, estrogen and testosterone, these are synthesized from the cholesterol, which is a steroid. The aldosterone, it's also synthesized from the cholesterol and it's also a steroid. While the oxytocin, it is a protein-based hormone, are made up of proteins. So therefore this option is correct one, that oxytocin is not the corticosteroid hormone. Next question pertains to the clinical side, that polyphagia, polyuria and polydipsia, these are the cardinal signs of. The polyphagia means increased hunger, polyuria means increased urination, and polydipsia means increased thirst. So these are the three cardinal signs of which condition? Given options are hepatitis, inflammation of liver, arthritis, inflammation of joints, diabetes mellitus, the condition of hyperglycemia, and diabetes insipidus, the oedematous condition. These three, the polyphagia, polydipsia and polyuria, are the cardinal signs of diabetes mellitus when there is deficiency or abnormality of the insulin to maintain the normal blood glucose level. Next question is, during pregnancy, dash hormone is increased in females. As you know that the progesterone is the hormone which maintains pregnancy and it is increased in the course of pregnancy, but in the options the progesterone is not available. So we look into the options, the estrogen, follicle stimulating hormone, luteinizing hormone or melanin. So among these options the melanin is the correct one, because the melanin hormone is also increased during the pregnancy state. It causes darkness of the skin of the females, and sometimes the dark patches are also produced on the skin of pregnant females. Next question is, dash is secreted from the Graafian follicles. Graafian follicles are located on the ovaries and these contain the premature ova. Besides this, these Graafian follicles also secrete a particular hormone which is asked here. Given options are estrogen, follicle stimulating hormone, luteinizing hormone or melanin. The estrogen, it is secreted from the Graafian follicles, so the correct option is A. The follicle stimulating hormone and luteinizing hormone, these are secreted from the pituitary gland. And melanin is secreted from the melanocytes present in the skin, melanocytes of skin. Next question is, vaginal birth or normal delivery, it is induced by dash hormones. Given options are estrogen, oxytocin, thyroxine or adrenaline. So it should be kept in mind that during normal delivery or expulsion of the fetus, oxytocin hormone is released which causes the uterine contractions, propelling the fetus outside the body through vagina, and this is also termed as vaginal birth. The oxytocin is also called as labor hormone because it causes labor pains and reduces the normal delivery or vaginal birth. So the option B is correct, with the vaginal birth is induced in the pregnant females. So these were some MCQs pertaining to the chemical coordination. Hope you have enjoyed the lecture. Thank you.